Good evening, everyone, and welcome to ATP Live Monday. I'm just trying to get the Instagram one on. I'm not sure I could manage to close. Welcome, everyone. Welcome. Please share the video and we can start. I'm just trying to get the Instagram one on. Welcome, welcome. Help me to share the video, share the link. Just give me 1 minute to get the Instagram new key on. Um, okay. Uh, okay. I should just go live on Instagram directly because I can't seem to get it. Alright, I'll just go live on Instagram directly. It's not to be working. Okay. Okay. All right. I just go think I have to go live on Instagram directly. All right. Welcome everyone to ATP Live Monday. This is a program where you get to ask any questions that you may have about the health of your children, and you can get immediate answers live from the pediatrician. So we got an hour to do that. So thank you so much for joining me. Just trying to make sure we share the videos and everyone can, okay, everyone can hear and everyone can see. All right, so just give me a couple of minutes to share the video and then we can start. But if you have any question, you can start to drop your question now and then we will start to answer them. So welcome, and Instagram people, I can see you. Welcome as well. You can start to drop your questions as comments on whichever platform you're watching on. If you're on Facebook, just click on the video. Make sure you're dropping a comment directly under the video. And if you are on Instagram, you can just drop it as comment as well on the Instagram uh, page you're watching on. So I'm just sharing as well and making sure that everybody can see and everybody can hear me. So we just got an hour to um, answer questions that you may have about the health of your children live. However, if you have any question beyond the live session, you are welcome to post your questions directly on our Facebook group. So welcome. I just need a couple more minutes to make sure that all the videos are pinned and everybody can see and everybody can hear. And then I can start to answer the questions. And yeah. So thank you so much for joining us now. All right. So I hope you've had a great Monday, first day of the week, working week. I know many of you always found Monday to be quite challenging after the lovely weekend. So, but it's good. Um, it's all good. So, welcome to ATP Live Monday. I'm Demi Salaboyde. I'm a pediatrician, and I'm here for the next 1 hour to answer any question that you may have about the health of your children, life and direct. So start to drop your questions. Just a gentle reminder, please start every question with the age of the child. Don't just say my baby, my baby, my child, my child. Please tell us the age of the child. And if you please always include information that could be relevant to us answering the question so that we are able to um, respond appropriately. All right. Okay, so I think we're good. Upsy Sunday. Thank you. Upsy surplus, sorry. So well done, ma. Thank you so much for joining me. Yes, I think I'm done with all the admin, sharing, pinning, and all that. So thank you so much. Yeah, official Debbie Matiso. Welcome. I'm not sure whether you said anything earlier, but you went with my daughter. You may want to make sure you post that question completely so that we can see it. Thank you so much, everyone, joining us on Facebook, on Instagram, on Twitter, on YouTube. You're all welcome. And for if you're watching the repeat broadcast, you're also welcome, whether you're listening to it on um, our podcast or any of the Facebook channel or YouTube, Instagram live, you're all welcome because I know some of you may not be watching the live, but for those who are watching live, you're welcome. I'm using a new laptop today and my laptop camera is down. So, but I'm used to my other laptop that the camera is up. So don't be worried if I'm looking off. I think it's because I'm getting used to this new one. All right, so let's just start. I've got a question on Facebook without much ado. So Aisha Haderibigbe is asking, thank you, Dr. Wemisola. I want to ask what is the cause of cerebral palsy? Okay, thank you. Cerebral palsy is a group of disorder. It's not one condition. We usually say it's a group of disorders that has to do with um difficulties with movement and posture in a child due to an injury to the developing brain. And this injury to the developing brain is non-progressive. It's a little bit of a long mouthful definition, but it's very, very important for us to define it that way because I see a lot of people using the word cerebral palsy for virtually any special needs or developmental disability. They are not the same thing. So there are differences between cerebral palsy and other developmental delays or disability. So one thing with cerebral palsy, there's an injury to the brain. The injury to that brain is not progressive. It's a once and that is it kind of injury, and the injury occur in the brain when the brain is still developing. So either when the baby is in the womb in the first few weeks or the first 3 years of life. Sometimes it can be as fast up to like 5 to 8 years, but usually most likely in the first 3 years of life. And that injury to the brain results in difficulties with movement and posture. Okay, so for a child to have cerebral palsy, there's something that has to do with motor. It's either the child could not walk, the child is stiff, or the child is having abnormal movements, but there must be something motor in it for it to be cerebral palsy. Unlike other developmental disability that may not have that motor component. So that is the definition of cerebral palsy. Number one, we have to be sure we are the diagnosis of cerebral palsy is correct. So I hope it is a diagnosis made by a doctor, a pediatrician, not just parent thinking, I think my child has cerebral palsy. That is number one. And so number two, so you now know where the injury. So in cerebral palsy, there's an injury to the brain, and the brain of that child is still developing. And so that injury can occur before the baby is born. We call it prenatal. It can occur while the baby is being born. We call it perinatal. It can occur after the baby has been born. We call it postnatal. So those are the three main categories of causes of cerebral palsy. Anything that causes injury to the brain before the baby was born, while the baby is being born, after the baby has been born, and the brain is still developing. The brain is still developing for the first 5 years of life. So any injury to the brain at that time will lead to cerebral palsy. And there are so many things that can cause injury to the brain. Even the mother, the mother didn't take folic acid, the brain was not properly formed, there's malformation of the brain, or the mother has medical issues, hypertension, heart problem, kidney problem, diabetes, and all those problems affect oxygen supply to the brain of the baby in the womb. That can lead to brain injury, and that or mom is taking drugs that are, you know, that's why we don't want to take in drugs in pregnancy that can cause brain damage. So all those things can happen. Majority of cerebral palsy happen while the baby is being born. So a baby is being born without proper delivery, I know. So baby did not cry. That's why when doctor say when we want to tell you let's do CS, my mother said it's not my portion, it's not this. When we're not saying you're not going to be able to deliver that baby, you will deliver the baby, but you would have caused injury to the brain of that baby. So the baby is born, but the baby is born with a damaged brain, and that baby is going to have cerebral palsy. So that is the issue. So it is not just the baby coming out with the stress of labor. Is there's a limit to what the baby can take. So once we know the baby is distressed, we say fetal distress, we need to deliver that baby by the fastest means possible. At that point, it is not the matter of can the mother deliver or not. It's a matter of can we get that brain intact without any damage to the brain. So that is what we're after. So because every time you contract, you are compressing on the blood supply to the baby, there's lots of blood supply to the brain, and that is a challenge. And so if the brain doesn't get blood supply and oxygen supply within 5 minutes, the brain cells start to die and they don't grow back. So those kind of babies are going to have cerebral palsy. Or babies have infection after they were born, meningitis, encephalitis, or baby have severe jaundice. So when we say jaundice, don't go and be putting them under sunlight or giving them purple water. Jaundice will always clear. That is not the issue. The what we are worried about is that before the jaundice will clear by itself, will it have caused a brain damage? So these are the issues. So there are some things when it comes to brain. Time is of essence. We have very limited time to save the brain. If you don't save the brain, the problem is that we eventually go. The baby will eventually breathe and have oxygen. The baby will eventually have all the jaundice cleared away, but the damage to the brain has been done, and that damage is permanent, and that child is going to have the complication of cerebral palsy. So these are the challenges. So maybe a baby that has even been born growing well, then the baby be, all of us, some of us are very careless with our baby. We let them fall down anyhow, and then they suffer head injury. Baby can develop cerebral palsy for that, or they were in a road traffic accident. The baby is not in a proper car seat and all that. Baby can suffer head injury, and they can have cerebral. So anything that causes damage, injury to the brain of a child whose brain is still developing, that can lead to cerebral palsy. So those are the few causes I've mentioned, but there are so many of them. And sometimes we don't even know the cause, but majority of the time we're able to figure out. So we usually do a brain scan when we suspect cerebral palsy, because that will always tell us there's an injury to this brain, and this is the injury that happened to the brain. This is the part of the brain that the injury happened, and that is what we now say as the manifestation. So that is a short summary of causes of cerebral palsy. If you want to read more about cerebral palsy, I have videos that have talked about cerebral palsy. There is a website article on cerebral palsy. It's all over our website. You may want to just go check it out. So I hope that's helpful. Let me go to Instagram. Okpesua. Hello, doc. My 4-year-old has been vomiting for 2 days with no fever. She vomits hours after eating. I'm giving her Pedialyte at the moment with a little bit of food. I don't know what else to give her. The most important thing is to know why is the child vomiting, because it's not something normal for a child to just be vomiting. So I'm more interested in why. And if a child is vomiting for 2 days, I really think you should go to the hospital. We need to know why, because you don't know why this child is vomiting. It could be even be indigestion, it could be anything, it could be because they say it's always related to food or hours of the food. So there's something going on. So you really need to know why the child is vomiting. And since we are not clear why, you have to go to the hospital so that we can ask you a lot more questions, and then we can figure out why the child is vomiting. Thank you. Um, okay. Somebody said, well done, ma. Thank you, Olufunke. Oloyede, thank you, Divine Ekele, thank you. Also, hope you're good. I'm good, thank you. Olufunke Oloyede say good evening, ma'am. Please, what caused a baby girl of 4 days to discharge blood from the vagina? Okay, thank you. That's a very important question because mothers tend to panic when they see the newborn babies having what look like a menstruation. Okay, let's just say that there's nothing abnormal about it. That is perfectly normal. It is due to the effect of the hormones of the mother. So the mother and the baby in the womb, your blood is so intermingled, okay? And so some of the hormones that a mother has, like your progesterone, your estrogen, they actually pass to the baby as well, okay? I mean, during the course of the pregnancy, and obviously they will wear out eventually. But so the effect of those hormones can manifest in different ways. It's also the reason why babies have these enlarged breasts. Okay, so it's the progesterone in the mother's blood that helps you to develop, get your breast developed so that you can breastfeed. It also works on the baby, and so some babies have this enlarged breast, and which we beg you, please do not massage it, do not press it, just leave it alone. Because some of us, in the process of trying to massage, and we actually cause more problem. Sometimes in medicine we say leave well alone. Okay, you sometimes do nothing is the best thing to do. No, you don't always have to do something about everything you say. And unfortunately, Nigerian mothers especially, we feel like we have to fix every issue that we see. No, you don't have to. And in the process of trying to fix what is not lost or what is not broken, we actually now cause problems. So some of us massage the breast and we introduce germs into the breast, and the baby will now develop mastitis or breast abscess, and we now have to start treating the baby with antibiotics for as what should not have happened in the first instance. So it's the effect of the hormone that can cause breast enlargement. It is the effect of that hormone that can also cause babies to have this whitish vaginal discharge, which is perfectly normal. Just leave it alone. All those things will clear because those hormones within a few days or weeks, they will clear out of the blood and the effects will also go away with them. So it is that withdrawal, is the withdrawal effect of the hormones that will cause baby to also have what look like menstruation, because that's actually what happens to you as a mother as well. So it's nothing to worry about. Just leave it alone. It will clear away and the baby will be fine. You don't need to do anything. You don't need to give any drugs. You don't need to apply anything. Just leave it alone. All right. And as the hormones, the estrogen, the progesterone, as they clear from the blood of the mother, of the baby will be fine and all those things will stop. So just do nothing. I really like to emphasize do nothing because a lot of you do something and then you cause more problem for us and we have to start stopping it. So please just leave it alone. All right, it will go away. It's a normal physiological thing and we don't have to worry about it. Okay, Divine say my baby of 6 months has insincua, whatever, front opening. Okay, so baby's head have openings is normal. It is not any see anything. It is not any oka. It is not nothing. Every baby is born with the normal opening in the skull. In fact, not one. We have two major ones, what we call the anterior fontanelle and the posterior fontanelle. It is normal, it is present in every baby. Are we worried if it is not present? And apart from those two big openings, there are also opening between the bones of the skull of the baby. Okay. Now, why are those openings there? It's because the baby's brain is not fully formed at birth. You know, when babies are born, only 70% of the brain has been formed. So the brain is still going to grow, and that is exactly the question I was answering about the cerebral palsy, because the brain is still a developing brain. So the brain will still going to get bigger. So we need space. We need to be able to, the skull, which is the brain case or the brain box, must be able to expand to accommodate the growing brain. And that's why those holes are there. They are not a problem. They are not a disease. They are not any problem. And most of you will go to all um these elderly women and all these women, experienced mothers and grandmothers, and oh, there's something your baby said. It is this incy, it is this oka, it is this. Stop taking those nonsense from those people, because people are giving you information that is based on ignorance. And if you've read my article on oka, which is available on our website, I employ you to read it. I gave a very sad story of a baby which have been diagnosed with this by somebody, and then they gave her this caustic whatever substance, black something, to apply, and that thing actually erode the skull because it was so caustic. It actually damaged the skull of the baby, and we can actually see the brain of the baby straight away, because the brain, what you see below that place that look like a hole, it's actually the brain. There's no bone covering in that place. So if you apply anything and that membrane, the skull in that area, gets damaged, you are going straight into the brain of your baby, and that baby developed a severe brain infection, and that baby has to have surgery and all that. So please leave your baby's head alone. It is breathing, it is this, it is that, it is a normal structure. Anterior fontanelle is normal in the brain of the baby, in the head of babies. The same thing with the posterior fontanelle. The anterior fontanelle is bigger. It will close on its own by the age of 18 months to 2 years. Okay. The posterior fontanelle may be closed right from the beginning, or it may be closed by around 0 to 6 months. It's a very small one. To admit only a fingertip for the posterior fontanelle. The anterior fontanelle tends to be bigger and diamond shaped. For babies that have very lot of hair, you won't even notice it's there. But for babies that don't have hair, that's a little bit bald, and or babies that's a little bit not fat and all that, sometimes because you can actually see their skull very well because there's little fat layers. It's more obvious in those ones, but it is a normal structure in the body, in the head of babies. It is not any disease. Okay, that is number one thing to say. Number two, because the anterior fontanelle is a space, that is opening directly under the brain. Anything that is happening in the brain of that baby, we can feel it from the fontanelle. So if there's too much water in the head of the baby, or if there's too much pressure in the brain of the babies, the place can become bigger. It become tense. It will shoot out, kind of, it will be full or tense. When you press it, it won't be soft. Normally when you press it, you should feel, your doctor will say it is flat and it is soft. You just touch it, you just feel it flat and soft. But when it is, there's a lot of pressure in the brain, maybe that is having brain infection or for other reasons, it will look very tough. When you press it, it won't be soft, it will look hard, and sometimes you can actually see it bulging out. We call it tense. And that can tell us, oh, maybe there's something, maybe there's a lot of pressure in the brain of this baby. We see that in children who have brain, like in meningitis, encephalitis, or even other conditions. Some children can have a blockage in the flow of the, what we call, the cerebrospinal fluid, the water that surrounds the brain, and that can cause the anterior fontanelle, I mean, the water not to flow out, and that can cause increased intracranial pressure, and we can see it bulging out. Number two, if the child is dehydrated, it may go down, it will be depressed. It will call it sunken. We use the word sunken, So instead of it looking flat and soft, it will actually look as if it's going down inside. It is sunken. We tend to get that in children who are dehydrated or who are malnourished. So the anterior fontanelle itself is not the problem, but the anterior fontanelle can give us information about other things going on in your baby's body. So if your child is having infection in the brain, or any other causes of raised intracranial pressure, the anterior fontanelle will feel full, will feel tense, will feel hard. Whereas if a child is dehydrated, maybe due to lack of enough fluid, or the child is malnourished, it will go down, it will be sunken, and that is telling us something. So the anterior fontanelle itself is not the problem, and it is not, there is no diagnosis, no matter what you call it in local native name, that has anything to do with the anterior fontanelle. Okay, so if your baby is anterior fontanelle, if your child is 6 months old and is looking like a 3 months old, that is not anything to do with the anterior fontanelle, and that is not any INSEE, anything. It has nothing to do with the head of the baby. All right, so that has to do with other things. So even though for your baby, your 3.5 kilo baby weighing 6 kilo, the weight is not that bad. Usually we expect it to double, should be 7 kilos, but 6 kilos is still okay. So please don't accept anybody making any unnecessary diagnosis, because what they will now tell you that, oh, it is not a medical problem, it is this particular native back concussion, it is this particular thing you should apply to the head of your baby. Please don't do that, because you end up creating more problem for this baby. If you think there's anything wrong with your baby, you have to take that child to the hospital and let the doctors look at your baby and tell you what is wrong. If the child is malnourished, if the child is dehydrated, for whatever reason, we will tell you and we will solve it. It has something to do with the anterior fontanelle. It is not the anterior fontanelle or the opening of in the skull of the baby causing the problem. Never. It is other issue in your baby's body that may show up on the anterior fontanelle or may not even show there. So please don't go use herbal drugs or apply anything to the head of your baby. I'm really stressing it because I know there are a lot of people around us that give us all this advice. And even some of this advice is unsolicited. You don't even need to ask them. Once they see your baby, this your baby, this thing, oh, your baby has, you see, whatever, your baby has okay. Just tell them my baby does not have anything. Thank you. I'll take my baby. Stop letting people give you, because I think somebody asked that question on Sunday, and like, somebody said this. I've asked my midwife, I've asked my daughter. She's like, just giving yourself unnecessary hypertension over nothing. So please just tell them there's nothing wrong with your baby and move on. Okay. So that is what I will say about that. All right. I hope I've not done super bad, but let me just leave that question there. Okay. Let's move on to the next question. Is there a cure for CP? What do you mean CP? Do you mean cerebral palsy? Um, Cerebral palsy, there is no solution to the damage to the brain. We cannot reverse the damage to the brain. It is done. It is done. It is done. That is that one. So stem cell, no, doesn't cause any reversal. And please don't waste your money, okay? Because I don't know why it is easier for people generally to believe fake news rather than believe the truth. Okay, a lot of people come online, and that's one of the, internet can be good, internet can be bad. But the challenge with that is that a lot of people will come online and tell you, oh, we can do this, we can do that. And I can tell you for free, some of my patients that have spent all their life money going to these places to go and do all this stem cell therapy, and the child came back worse than what the child was even before they left. So please, medicine is evidence based, okay? And so what evidence based means that if you say, if I use this drug and it will cure something, then I in Nigeria should be able to give that same drug to 100 of my patients and it should work. Somebody in UK, in US, in Canada, in France should be able to do the same thing, and we should be able to compare the results, and we should all be getting the same thing. And then that is when we will all agree that yes, truly what you're saying is true. Okay, but if somebody is saying, oh, I use this thing, okay, and say it works, then other people try it and it doesn't work, then it's not really working. And so that means there's no evidence. So what I'm trying to say, that as of today, I don't know tomorrow, as at this evening, 6:30 p.m. West African time, we do not have a cure for cerebral palsy, and stem cell therapy is not a cure for cerebral palsy, and it's not working. It's not yet an evidence-based treatment. Okay, so we cannot reverse what has happened to the brain. We cannot change the damage in the brain. But what we can do is we can manage cerebral palsy. So we can do some other things to make that child live a um a meaningful life, So what is the issue with cerebral palsy? The child cannot walk, or the child is not able to. We can give the child a wheelchair, and the child can move with the wheelchair. At the end of the day, we've achieved the purpose. The purpose is that you can move from A to B. Okay, so if you cannot walk from A to B, can we give you a device that will move you from A to B? Okay, so you cannot use your hand to write or something. Okay, can we give you something that you can touch and that it will write for you, or you can talk? This is technology has really taken over most of those things. Even people that have hand, they don't write anymore. We all dictate into our laptop, into our system, and it writes for us. So we are using technology to help people overcome their difficulties. That is what we do. Now, number two, I keep saying number two, but whatever, just take whichever number it is. Um, Cerebral palsy has different levels. So we have cerebral palsy that are mild, we have cerebral palsy that is severe. Okay, so there are children with cerebral palsy that will walk, that will talk, and that will go to school, and that will become doctors, lawyers, whatever they want to be. There are children with cerebral palsy who will never walk, who will never talk, who will need 24/7 care all their lives. That is a severe cerebral palsy. So it is like that. So it is difficult for us to say, because most parents want, they want us to tell them, we might be able to do this, we might be able to do that. We have some scales for measuring that. And so if your child is what we call GMFCS1, your gross motor function is type 1, type 2. Most of those children are fine. They go to everything, they can do everything. Some of them may need maybe a little bit of walking aid or some device to help them, but they'll be able to do most things for themselves. But children with severe cerebral palsy, they will need help, okay, all their lives. So it is important. Unfortunately, parents that have children with type 5 cerebral palsy, they will look at the children who have type 1 cerebral palsy or type 2, and they want their children to become type 1. We can't always do that. And no matter what stem cell, whatever you do, you will not be able to achieve that. That is the truth. So what we can do is to prevent that damage from happening to the brain. Of course, there's still a lot of research going on and all that, but please, things that are still in research, uh, when it is, we have tried it, we have done what we call clinical trials, and it is now working, we will be the one to tell you, okay, we now have a new treatment. This is what we now do, and this is what will work. I'm saying this because a lot of parents become impoverished trying to look for a solution that is not available. And there are a lot of people that also prey on such parents because they will promise you heaven and heart, and then they will tell you, you are sure we can do this, and people will spend thousands of dollars and all that doing all these things, and then they will get disappointed. So I would say, instead of using all your life savings doing that, why not focus on what can make the child's life better, that works for the child, the therapies, the aids, and all that we know we can do. So we scientists will tell you the truth, the evidence. Well, if you want to follow those who are going to tell you the lies, so but that's how I normally counsel my patients. So please just be aware, okay? And that is, I will stop at that point. All right. Somebody say, what is the cause of jetty in babies? Number one. Okay, so when you are asking questions on ATP, some of us are new. Um, don't tell us your own name for that condition. Don't even tell us what you think is the diagnosis, because you use a lot of local names which does not necessarily have a medical equivalent. So even now, I know you are trying to say jadi jadi, you've written it as jadi jadi, but these are names people use to mean different things. So there's a time I did a research on ATP people, and I tell them to tell me when they say the word jadi jadi, I want them to write it for me, what to describe it in words, what they really meant. And at the end of the day, we had over 20 different answers. So when people say jadi jadi, they different people mean that word for different things. So it is not one word. It's the same thing with ela. People use the word ela for rashes, and they mean different kind of rashes. So there's no medical equivalent. So there's nothing like jadi jadi in baby. So just tell us, what is this you are seeing in your baby? What is the symptom? So some people say jadi jadi is when the baby is having blood in the stool. Some people say it was when the baby is having like what we call rectal prolapse, something is coming down, or hemorrhoids, something is coming out from the anus. Some people even use it to describe back pain. Some people use it to describe some rashes. So, different things. Some people used to describe abdominal pain. Some people used to describe blood in the stool, dysentery. So different people use the word for different things. So at the end of the day, there is no, so when you say jadi jadi, it doesn't make any sense to me, because I don't know which of the 20 different meanings that people have given me that you are referring to. So when you want to ask questions, it's better to tell me my child has cough, or my child has blood in the stool, or my child has these rashes here and there, and then I will tell you what is in equivalent in English or in medical parlance for that, and then I can now tell you the cause, and I can now tell you the treatment. So there is no any dedi anywhere, because it's a word that people use for over 20 different things. This is not what people told me. This is what I did as a research for myself on ATP. And the post is still there if you search our group for it. So we just ask people, tell us, write this in words, what you meant when you say chedi chedi. And it's like over 20 different answers, which are over 20 different diagnoses in medical jargon. So it's not one word. So we don't generally like to take native words. It's just the same way people are saying insi or another. Some people use it to mean just the anterior fontanelle, and some people use it to describe other conditions like malnutrition and all that. So it's best to use, just describe it in words. What is your baby doing, or what is your baby not able to do? And then I can now tell you what I think you are trying to tell me in terms of diagnosis. Then I'll be able to tell you what it means in terms of the cause and the treatment. So you can always ask that question again. Divine, if you are still listening to me, just ask again. Don't say it is jadi jadi or ela or this. Just tell me, I observe my baby has this or that symptom. You know, simple English word. Don't use any native jargons, and then we can move from there. All right. Is it healthy for an 18 months old baby to eat raw onion? There's nothing wrong with eating raw onion. It's just like vegetable. If you want baby to eat it, it's fine. Um, Aisha, thanks so much, Dr. Pimla. Your explanation of cerebral palsy is well understood. Okay, great. I'm happy that at least I've done one good thing today. All right. Let me see whether there's anybody on Instagram. Okay, yeah, there's a question on Instagram by Bibiok. My baby is 7 months and she's weighing 8 kilos. Is she overweight? No, she's not. An average 7 month old should actually weigh 8 kilos. Yeah, so that is fine. That is normal average weight of a 7 month old. So I'm not worried about the weight of your baby. All right. Christy, look, good evening. Thank you for all you're doing. My baby of 10 months and a week had for the past 5 days, past five, always feel warm. I hope you mean 5 days anyway. But baby is active. So if your baby feels warm, get a thermometer and measure. So your hand is not an instrument, it is not an objective way of checking temperature. That is why we created an instrument called a thermometer, and I expect every mother to have a thermometer at home. There are digital thermometers. It used to be as cheap as 500 to 1,000 naira. So I don't know how much it is right now because of the way the naira is going up and down. So, but you should have a digital thermometer or infrared. Just have one at home. If you think your child is warm, just measure it. That is all. We cannot rely on it's warm, it's hot, is what is the thermometer saying? Anything above 37.5, that is fever, and that is when we will now begin to think what is the cause of the fever, and then we can work it out. But the head is warm, the head can be warm. There are many reasons why the head can be warm, more than other parts of the body, but let's not go into that. But the brother need check it with the thermometer, and then let us know what is temperature, and then if temperature is anything less than 37.5, that is normal. We don't need to do anything beyond that. Okay, good evening, Opsy surplus. Okay, how should I treat eye discharge in an 8-week-old baby? Number one, you do not treat anything as a parent. You don't treat anything. Okay, yeah, that's not your job description. That is our job description as doctors, to make the diagnosis and to treat. Okay, so if your child has high discharge, you have to take that baby to the hospital. There is a eye discharge babies have. Most of us have it as well. When you wake up in the morning, you have this whitish discharge, and you just wash your face, and that is it. That is not a problem. That is normal. But if your child is having like yellowish, eye discharge that even throughout the day is coming out, and the baby is also having maybe red eyes, or maybe it's itchy, or it's even gumming the baby's eyes together. If you go to our Facebook group, you see a lot of pictures of such, then that is possible infection, and that child will need treatment. Most of them will need antibiotics, eye drop. Please don't go and buy it yourself. Okay, there are a lot of things that go into doctors prescribing drugs, including creams and eye drops and stuff like that. So please, you don't self-medicate your 8 weeks old baby. You have to take that baby to a hospital and let a doctor. Sometimes we have to take a swab of the discharge. We have to send it to the lab, because the lab will not tell us this is a particular germ or bacteria that is causing this um high discharge, and this is a particular antibiotics that work for it. So you really need to be aware of all that. So just take the baby to the hospital and let the doctors take it up from there. Okay, Juliet Sunday say my baby of 1 year, 2 months always like biting someone, and most time eating her head on anything whenever she's angry. Please, is it normal? Definitely, it's not normal for somebody to be biting. It's not normal for somebody to be eating their head. Some babies do it as an habit. It's a behavior thing for them, but some it could be a pointer to a developmental problem. So especially if they do it repetitively, and they do it for no absolute no reason. So we tend to see that also in children who are on autism spectrum. So we really need to be able to know, is it a behavioral thing? Is it so? For example, if your child, if you think it's teething because that's what you are trying to insinuate, you can give the child something to bite on. Like a teeter, like all these soft toys that they can buy on. But if it's something the child does, and it's also in the context of a child who is also having other developmental delay, who is not talking, who is not interacting with other children and all that, then we want to see that child for further assessment. So if you are not sure which is which, then you may want to just let a pediatrician check out the baby for you. All right, I will go to Instagram so that I don't lose Instagram people. Okay, I've answered that one. Tokwe, I don't know what's the other. My 6 month old baby drops her head while sitting or while lying down. I'm trying to understand. Drops her head. You mean, are you saying the child doesn't have neck control or what? Because I really need to be clear on that question. A 6 month old baby is just learning to sit. So they should be sitting with support. So they should be sitting with some support. That is what you expect for a 6 month old baby. But you said while lying down, drops her head. That question is not clear. Do you want to clarify? Because if your child is lying down, we expect that the head is flat already. So how is the child dropping the head lying down? So I'm trying to imagine your question. I'm trying to reason it in my brain and it doesn't make sense. So you may want to expatiate what you really meant by that. But if the worst that can happen, or maybe what I'm suspecting, is that if your child doesn't have neck control, because at 6 months we expect the neck to stay straight, not to be bending and not to be, going to one side. So if your child's neck control is not there, you have to see a pediatrician immediately, because a 6 month old should have neck control. So we need to know that. But if you want to clarify, feel free to clarify that. Okay. Juliet Sunday, my baby of 1 year, 2 months old. Okay, I've answered that question. Excuse me. I think I've just answered that one. Ade Halade Goroye. Taufika, good evening, Doc. How can one drink cradle cap in a 4 weeks old baby? Number one, we have to be sure what you are referring to is cradle cap, because I'm very, very wary when parents tell me this is what it is because I want to be sure when we are not giving you the wrong information for the wrong thing. So I would rather you send us a picture of that what you're describing, especially to avoid giving a diagnosis kind of question to a pediatrician, because we just always want to be sure so that we don't give you the wrong answer. I prefer you tell me this is what I saw in my child. My baby has like what look like dandruff, scales, whatever. Then, or rather than say it's cradle cap, because what if it's a fungal infection on the head? What if some people say different things and it's different, and the treatment will be different? So, if you don't mind, I'd rather you just post a picture of it on our Facebook group. Let's confirm first it's a cradle cap, because if it is cradle cap, you don't really need to do anything. You just need to make sure you wash the hair of the baby with what we call hair with air shampoo that is age appropriate for a baby, and then you gently comb it out. You comb out all the flakes, and just do that every day, and that's it. There's nothing more than that to do. So, but just make sure it's not something else that is going on with the baby. Okay, divine. Okay, so you've understood. All right, I'm happy. I'm happy to hear that. Thank you so much. Thank you so much. Um, she drops the head randomly and on the same on tummy time. Okay. Anyway, so what you need to do is to let your baby lie down flat. When your baby lies down flat, pick up the baby with the hand. That's I'm not sure I have a picture here. I usually have a picture of that. So you pick up the baby with the hand and pull the baby up with the hand and pull. A 6 months old head should come with the rest of the body. It should not be going down. So if your baby's head is still going down, it's not coming straight with the rest of the body, that child does not have neck control. That child needs to see a pediatrician, and that's what you need to do. I'm not really sure I get your answer because it's dropping. Because you have to be clear that this child is also not having seizures, because there are people that actually have seizures, which is what we call infantile spasm, in which they begin to, they have this sudden episode where they just kind of flex their head and the rest of their body, and then they will do it several times. That is different from a child who doesn't have neck control. So you need to be sure which one it is, or better still, just do a 1 minute video of whatever it is this baby is doing and let us have a look, because we really need to be sure. Because if it is lack of neck control, or if it is infantile spasm, we really need to know, because those conditions, both of them really need to see a pediatrician, or better still, just take baby to see a pediatrician so that we can take it up from there. Cecilia, how do you know the type your child belongs to for cerebral? Are you talking about cerebral palsy? Okay, so we have a way of. Okay, let's just start by saying that any child who has cerebral palsy should have a pediatrician, should be seeing a doctor, should be seeing not even just a doctor, must be seeing a pediatrician, preferably a pediatric neurologist or a neurodevelopmental pediatrician. And one of the things we would have to, we will normally tell you that your baby is type 1, type 2, types. We should be telling you that. Because when we make a diagnosis of cerebral palsy, there are 4 things we are going to be telling you. Number one, we're going to tell you the type of cerebral palsy your baby has. So there are type of cerebral palsy that affects half of the body. There are type that affect the whole four limbs. So there are some that affect only one limb. So we have what we call, there are some that are spastic, the child is very stiff and all that. There are some that the children have what we call abnormal movements. We have called ataxic cerebral palsy. Then we also, apart from the part of the body and how it is spread in the body, we have to tell you what is going on in the brain. What is the cause of this cerebral palsy? Okay, so is it the child, that's when we do a brain scan. Anyway, we normally have to do a brain scan, and then we need to tell you the functional level of the child. So what can the child do? And so we talk about function. So that is what we talk about, that type 1 to type 5. And then we must tell you um in terms of other conditions that are present. So is this child also having epilepsy with the cerebral palsy? Is this child also having blindness? Is this child also having deafness? Is this child also having learning difficulties? There are people that have cerebral palsy we don't have intellectual disability, and they're very brilliant, even though they are in wheelchair and all that. So we must be able to tell you what are the other associated conditions. So those 4 things your doctor must tell you when you tell your child has cerebral palsy. So it's very important that you are seeing the right profession. That's why you should not make those diagnoses yourself or rely on other parents telling you, or even therapists. It is not therapists that will tell you those diagnoses. It's a pediatrician, pediatric neurologist, neurodevelopmental pediatrician that should make those diagnoses, and you should be following up your child, because sometimes the other problems that come with cerebral palsy is even worse than the cerebral palsy. Some children have worse epilepsy, or is it drooling that the parents are really worried about, or is the intellectual disability itself. So there are other issues that come along with cerebral palsy, even that may be more problematic than the cerebral palsy. So that's the job of the doctor, to make that call and to tell you which one it is. So your child should be going for regular checkups and follow-ups with the pediatrician. We have if you come on our Facebook group, I have a parent handbook on cerebral palsy. It's just like a PDF document. If you go to our Facebook, all this information are there, because we expect parents to know all this information, because the management of a child with cerebral palsy, we have to do it together, ourselves and yourself. So if you go to our Facebook group, just ask parents handbook on cerebral palsy. Somebody should be able to give you the link, or you go to our file section, just go through the file. There are plenty information there, but look for the parents handbook on cerebral palsy. All this information, including the causes of cerebral palsy, including things you can do at home as a parent, because you are still part of your child's therapy team. All those information are there, and I think you may find it very useful. So just check our Facebook group, Hacks the Pediatricians. We have all this information there. So, okay, Divine said, I've observed blood stool. Okay, you are the one asking about jadi jadi. Okay, fine, good. So, blood in the stool, we call it dysentery. Dysentery is blood in the stool, and it usually means there's something wrong, there's infection, especially if it is watery stool with blood. Sometimes baby can also pass blood on his own, in which case the child is actually bleeding along the intestinal tract. So whichever one, blood in the stool, that child has to go to the hospital. We have to see a pediatrician. Number one, we need to confirm that it's blood, because it's not everything that looks red in the stool that is blood. So there's a way we confirm that it's blood. That's number one. We'll do a stool test for blood, and then we need to now confirm what is the cause of the blood. Is the child bleeding, or is it an infection? So if it's an infection, we need to give antibiotics. If it's bleeding, we need to know why the child is bleeding, where the child is bleeding from, and how do we stop it. So that child has to see a pediatrician urgently. All right. So rashes around the neck and armpit, there could be many different kind of rashes. So a picture of the rash would be helpful. So picture of the rashes will help us to know what can you say, a fungal infection, is it allergic, is it, so we need that. So though from what you stand, usually rashes around what we call the skin fold area, because the neck, the armpits, you have skin fold, and then you see this red line in between those fold. Most of them are usually due to fungal infection. We call it intertrigo, but I'm not sure whether that's what you are saying, but that's what I'm thinking of, because of those two areas, what we call the fold areas, where the skin fold on top of each other. Also on the thigh area, you can also see that. But the best thing for rashes, we need to see it. We can never make a diagnosis of rashes without seeing it, and then we need to now tell you what to do. Whichever way your baby has to go to the hospital, you have to see a pediatrician, and then we can take it up from there. All right. Thank you, Happiness. Thank you, Christiana Damilola. Oh, thank you. Um, Carlo, how do you take care of body skin in this heat season? Very good question, because I've been seeing a lot of boils and rashes and stuff, and I know it's because we're in a season where there's a lot. Because in Nigerian weather, we have what we call hot and humid weather. So hot and humid tends to favor bacteria. So that's why our children tend to have all these boils. Whereas in people in temperate, like those in abroad where it is cold and dry, they tend to favor the viruses. So they tend to have the flus and all that. Whereas those of us in the hot and humid, we tend to favor the bacteria. It's a weather that they love to thrive in. So what do you do in this? It is number one is to cool the children. We need to cool them. So number one, let's let our windows be open. I know some of you say there's no lights, but if you have lights on your inverter, please use the fan, use the AC, let the children be cool. That's what you need to do. If you don't have fan and AC, open your windows, let the breeze blow. Then let's wear children weather appropriate clothes. So this is not the time to start wearing them sweater and wearing them thick layers of clothes. No, let them wear something light, something cotton, something, those singlets kind of texture, something that is uh, that is not too thick and is cutting, so that there can be a lot of circulation. Air can move in and out, airflow will not be in there. So this is not time to start wearing silk pants or all these polyester materials. So wear cotton light materials for children. Let them have the bath. Let them wash their hands a lot. Wash their hands with soap and water. We too, we need to wash our hands with soap and water before touching our children. Most of these boils and other is from our hands, and our hands are full of germs and bacteria, and then you just touch the children and touch, then you're going to have all these infections. So we need to make sure with that. And let's just try as much as possible, let the children be cool. When the weather is hot, let them stay indoors. Let them know that's not the time to start going. I know we believe that our son can be quite biting, so you may want to use all these cream that has SF. I'm trying to remember what's the full name now. Something to kind of protect the skin against sunburn, against the infrared rays. So there are sun um those sun cream. I've forgotten the name. The name just escaped my brain. Something you know what I'm talking about, that you apply on your baby's skin, and it will protect them from sunburn and all that. So we may need to apply that as well. So that's what we can do, and I'm pray that the weather changes as soon as possible. All right. Good evening, Igwe. Dara Chidima. My son is 5. He can't write properly except scribbling and scrolling. What do I do? 5 years old should be writing. You can have this conversation with the teachers first, and what have they done to help the child, so they may need to give some extra support around that. But that is if that is the only issue, because sometimes parents, you ask questions, you only pick the part that you think you should bother about, and then that's the question you're asking. But are there other issues? So is this child not only able to write, and that is the isolated thing, every other thing else is fine, or is this child also having other multiple developmental issues? So because the management would depend on whether it's just an isolated writing issue or it's a global developmental delay issue. So, which for me, if your child is in school, speak to the teachers first, as they'll be able to tell you whether it's just the writing that is the issue, and then they'll be able to give you support. Because a 5-year old should be able to draw a person at least with at least 4 to 6 body parts. So we expect a 5-year old to do that. So not just scribbling and scrolling. That's the level of a 2-year old, to be honest. So, which is why I'm wondering whether is this an isolated problem, or this child also has global developmental delay. Does this child need to have a proper assessment with a developmental pediatrician, or does this child needs to or is the child just struggling with the writing, in which case an occupational therapist or even the teachers alone will be enough to help the child. So that's something you may want to think about, and because that will determine a professional that will support the child. So that's why I'm asking these extra questions. All right, I can't see any more question on Instagram, and I think that's the last question on Facebook, and I think my time is almost up. All right. So if you still have any questions about the health of your children, feel free to go to Ask the Pediatrician Facebook group. Our groups are open Mondays to Saturdays, 24 hours daily. And you can ask your questions there. Those of you who ask questions about rashes and all that, please, we need a picture. Please put a picture there because that will really help us if your child is doing anything abnormal behavior, abnormal movement, you are not sure whether it's normal or abnormal, put a short video, not more than 1 minute long, to help us. I know some of you don't like to show the face of your children. That is fine. You can censor the face, but if it's a seizure, we actually want to see the face. So the other alternative is actually go see a pediatrician in the hospital, and then they can take it off from there. So just for you to know that even though this program is ending now, you can always ask your questions from Mondays to Saturdays. We don't do question and answer on Sundays. That's our break time. But Monday to Saturdays we're there for you. And of course, if it's an emergency, please you have to go to the hospital. I mean, I know you are very sensible parents. So as sensible parents, you should know when to go to the hospital and when to come and ask us. If you just want to ask question or health education kind of question, and how do I help my child to eat? How do I help my child? Or what do I do in this scenario? Yeah, that's fine. Well, if the child is very sick, he's having fever, he's convulsing, he's not breathing, is no, yeah, taking abnormal, poison and all that. That is not ATP level question. That is an hospital. I have to go. It's an emergency question. So I believe that as parents, we are very, very. Uh, we know the right things to do. Let me put it that way. We're very sensible. All right, the last question I will take before I leave. My baby also yes sneezes a lot, especially in some environment. Yeah, it may be allergy. So maybe the child is reacting to something in those environments. And what you really need to know is what is it in those environments? Is it the dust? Is it the smell? It could be anything. So if you can figure out what it is that is causing the trigger, then you avoid it. That's what you need to do. Avoid environment that make the child to sneeze a lot. And if the child is sneezing a lot, even for no reason, like even when there's no obvious reason, then you want to see the ENT doctors to help you because some children can have allergic rhinitis, which is an allergic condition, and they tend to sneeze a lot. And they sneeze like very bad, like they can go on it for like minutes and all that, not just occasional one. So in that scenario, you need to see the ENT doctors. But if you know the things that tend to trigger it, then all you need to do is to avoid. Some of you don't need to be using perfumes in your house. You don't need to use all these hair fresheners and all those sprays for mosquitoes and all that because some children are allergic to them, and sometimes you just have to avoid them or you use them when those children are not around, and then make sure there's enough space for it to have the smell to have gone before they come back to the house. So you just have to figure out which one it is, and that's what you need to do. All right. So thank you so much, everyone, for joining us. And on Thursday, we'll be here for the teaching session. So Thursday is our teaching session. Monday is our Q&A session. Teaching session this week. I think we're going to have something on childhood cancer. So watch out for it. One of our radiation oncologists will be taking that topic. And if you have any questions, I know some of you think, oh, children don't have cancer. Children have cancers as well. Yeah, they do. And it's important for us to know. And the reason why we need to know is so that when we see it, we we pick it up on time and we go for therapy. Because one thing with childhood cancers is that if you pick it up on time, we may be able to save the child and the child will not die from it. So just watch out for that topic and all that. But like I said, if you still have any question, even after the teaching on Thursday, feel free to post a question on our Facebook group and I will see you same time next week by the grace of God. Have a wonderful, wonderful evening and it is bye. Bye bye.